The service can be from 1 hour to 2 hours a week to 20 hours a week of services. So it depends on the need of the child. I would say is the language, and I would say also the information. Sometimes some of the families tend to be, more, or they don't look for the resources because they don't speak the language. So I guess the barrier is that if they don't know the language, it's hard to get information when it's not in their own language.
A lot of the times when children can't express their needs or their wants or something that they don't want, they will see a lot of aggressive behaviors. They'll do a lot of screaming or throwing or hitting, because a lot of the times when they do that, they're really alarming their parents, and their parents will be like, okay, what do you want? And they'll kind of take everything out and they'll offer them an array of objects. So what we start with, if they don't have any gesturing skills or any vocal skills, we'll start with pointing. That's a big thing, so that once they start pointing, they can express what they want and they can communicate, and that will decrease other behaviors. So gestures are very important, and it is considered a part of verbal language.
Let's say Spanish speaking family, most of this literature is in English. So unless we have a person that speaks the language and they can explain to the families what is this diagnosis or what are the services available, I think that's one of the barriers, the languages. I see probably immigrants or people who do not speak the language are at a disadvantage compared to other people that speak the language, or I guess also that the level of education also influence that. We see more educated parents that do whatever it takes to get information from anywhere, as compared to other people that are less educated, that don't know where to go, don't know how to ask, and also the language. I think that's the disparity.
If there are more than one language spoken in the house, that might affect their learning of both languages. But if there is one language spoken, typically, if they're from another country, typically they should learn that one language. Okay. Sometimes they do show a delay in languages if they're exposed to both English and Spanish, or whatever the languages may be.
10 years ago, there was not a lot of information outside for this type of disorder. I would say right now, with what the city, the state, and we see private organizations doing, is they're putting the word and the information out there, so everybody has access to it. Even speaking about Spanish families, Spanish-speaking families, they have more access now because, again, like I said, private organizations, doctors know more about autism. So I would say that there is a lot of people, coalitions, and I think even to the state level, trying to put information out there so it gets to all the families.
I do have a lot of families that are immigrants that come to the program, and we give them pretty good therapy, I would say, and we inform them of all the different programs and schools and resources available to them.
I think the best we educate the parents, and the best plan of action from the therapist in terms of getting the more or the most updated information and techniques to treat the children, the better the parents are equipped to treat and help these children. So I think that's important, to have professionals that know how to treat these children and how to help the families to properly deal with them at the home.